Have you ever wondered why insulin resistance is becoming a global health crisis? Welcome to the Victory Education Lounge, your trusted source for navigating health topics that matter. Today, we're turning our lens toward a burgeoning concern that's affecting millions worldwide: insulin resistance. This is part 113 of our enlightening series on metabolic health, and we're going to delve deep into the global impact of this condition. Before we dive in, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Insulin resistance is not just a personal health issue but a global one. Its reach extends beyond borders, affecting both developed and developing nations, and its implications are far-reaching. It's a crisis that demands our attention, our understanding, and our collective action. So whether you're personally affected by insulin resistance, concerned about the health of your loved ones, or simply interested in understanding the health landscape of our world, this video is for you. Stay with me as we uncover the global health crisis of insulin resistance. Before we dig deeper, it is vital to understand what insulin resistance is. Insulin is a hormone that your body uses to regulate the amount of sugar, or glucose, in your bloodstream. It acts as a key, opening the doors to your cells and allows glucose to enter and be used for energy. But what happens when the key doesn't fit the lock? This is essentially what occurs in insulin resistance. Your body continues to produce insulin, but your cells become less responsive to it. They start to resist the effects of insulin, hence the term insulin resistance. This resistance means that glucose can't enter your cells as easily. As a result, it stays in your bloodstream, leading to higher levels of blood sugar. This situation triggers your pancreas to produce even more insulin, in a desperate attempt to get your cells to respond. Over time, this cycle can lead to a number of health issues. The most well-known is type 2 diabetes, where your body can't control its blood sugar levels effectively. But that's not all. Insulin resistance can also increase your risk for heart disease, stroke, and kidney disease, among others. So how does insulin resistance develop? It's a complex issue with many contributing factors. Genetics can play a part, but lifestyle factors such as poor diet, lack of physical activity, and obesity are significant contributors. The good news is, insulin resistance can often be managed or even reversed with lifestyle changes. Healthy eating, regular exercise, and maintaining a healthy weight can all help your body use insulin more effectively. However, in some cases, medication may also be necessary. Understanding insulin resistance is the first step towards addressing it. By recognizing the role of insulin in our bodies and the potential consequences of insulin resistance, we can begin to take action. Knowledge is power, and in this case, it could be the power to prevent or manage a serious health condition. Now that we understand what insulin resistance is, let's explore its global impact. First, let's look at the prevalence of insulin resistance in developing countries. These nations are experiencing a rapid rise in cases, often outpacing their healthcare resources. The challenges are significant, from lack of awareness to limited access to quality healthcare. However, it's not all doom and gloom. Potential solutions are within reach. Cost-effective screening programs could help identify at-risk individuals early, while preventive measures through lifestyle education can empower communities to take control of their health. For instance, several countries are already taking proactive steps. India, for example, has implemented a national diabetes prevention program that reduced the rate of new diabetes cases by a quarter over 5 years in pilot regions. Developing nations are fighting an uphill battle, but with the right strategies, they can curb the rise of insulin resistance. Next, let's consider the economic impact of insulin resistance on global productivity. The ripple effects of insulin resistance go beyond individual health, reaching into the sphere of workforce performance. People grappling with this condition often experience fatigue, lack of focus, and other symptoms that can hamper productivity. Moreover, absenteeism due to related health complications adds to this productivity challenge. This is not just a problem for the individuals involved, but also for corporations, economies, and indeed the global economic output. But there's a silver lining here. By adopting proactive measures such as workplace wellness programs, corporations can help their employees maintain better metabolic health. Additionally, policies supporting regular health checks, dietary adjustments, and physical activity can be implemented. These strategies can result in significant improvements in workforce productivity and individual quality of life. Just imagine a world where your workplace actively supports your health. By prioritizing metabolic health, corporations can help mitigate the impact of insulin resistance on productivity. The rise in insulin resistance is also straining global healthcare systems. This is a statement that echoes in the halls of hospitals, clinics, and health organizations worldwide. As the prevalence of insulin resistance grows, so does the burden on our healthcare systems. From overworked medical personnel to overflowing patient lists, the impact is real and far-reaching. Imagine a dam holding back a river. As the water level rises, the pressure on the dam increases. It's the same with our healthcare systems. The growing number of patients with insulin resistance and its resulting complications, such as type 2 diabetes, cardiovascular diseases, and obesity, are like the rising water level. And our healthcare systems? They are the dam under increasing pressure to provide care, manage resources, and find solutions. Now let's talk about solutions. One approach to manage this crisis is investing in preventive care and early intervention. This means focusing on lifestyle changes like healthy eating and regular exercise, as well as early screening for at-risk individuals. By catching insulin resistance in its early stages, we can prevent or delay the onset of related diseases, reducing the burden on our healthcare systems. Another solution lies in the power of technology. Telemedicine, for instance, can be an effective tool to reach underserved populations, those living in remote areas or those who, for various reasons, cannot access traditional healthcare services. Telemedicine can provide remote monitoring, virtual consultations, and digital education, enabling early intervention and ongoing management of insulin resistance even from a distance. But these solutions are not without challenges. They require significant investment, policy changes, and infrastructure development. Yet, their potential benefits, reduced long-term healthcare costs, improved access to care, and better health outcomes, make them worth considering. A prime example of the power of these solutions is Thailand. The country successfully implemented a national telemedicine program for diabetes management. This innovative approach led to a reduction in hospital admissions for diabetes complications by 30% in rural areas. With investment in preventive care and technology, we can reduce the burden of insulin resistance on healthcare systems. Because at the end of the day, it's not just about managing a health crisis, it's about creating a healthier world for us all. Lastly, let's look at how global food systems and environmental factors contribute to insulin resistance. The global food industry plays a pivotal role in this epidemic. From the way food is produced, processed, marketed, to how it's consumed, the system is currently geared towards foods that are high in sugar, fats, and additives. These foods are often more affordable and accessible than their healthier counterparts, leading to poor dietary habits and contributing to insulin resistance. So, what's the solution? It lies in implementing global policies on food labeling and marketing. Transparency in food labels can empower consumers to make healthier choices. Regulating the marketing of unhealthy foods, especially to children, can also help curtail the consumption of such foods. Moreover, incentivizing the production and distribution of healthier foods can make them more affordable and accessible. However, these solutions are not without challenges. They may face resistance from powerful food industry lobbies who often prioritize profit over public health. But as an example, Chile has shown that it's possible. They implemented strict food labeling laws and restrictions on unhealthy food marketing, leading to a 25% reduction in sugary drink consumption within 2 years. On the other hand, environmental changes also contribute to the rise in insulin resistance. Increasing pollution, sedentary lifestyles, and urbanization can indirectly influence our metabolic health. Addressing environmental pollutants linked to metabolic disorders and promoting active, sustainable lifestyles are key steps towards mitigation. Take the case of Denmark. They've prioritized cycling infrastructure, leading to more active commutes and lower rates of obesity and insulin resistance. But it's important to note, these solutions require significant policy changes and societal shifts. In conclusion, the global food industry and environmental changes play a significant role in the insulin resistance epidemic. By implementing policy changes and promoting healthier lifestyles, we can begin to turn the tide. Addressing these factors is crucial in our fight against the global insulin resistance epidemic. We've covered a lot today, but the conversation doesn't end here. We've delved into the global impact of insulin resistance, From its rapid rise in developing countries to its effect on worldwide productivity, we've explored how it strains healthcare systems and how global food systems and environmental factors play a role in this epidemic. It's clear that insulin resistance is a multifaceted problem that requires a global solution. By implementing cost-effective screening programs, promoting workplace wellness, investing in preventive care, and making changes to our food systems, we can begin to combat this issue, but we need your help. The more people understand insulin resistance, the better equipped we'll be to tackle it. So share this video with your friends, family, and colleagues. Let's continue this important conversation about insulin resistance and its worldwide impact. Help us spread the word about this global health crisis. Share this video and join the conversation in the comments below. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions should be discussed with a licensed physician, and global health initiatives should be developed in consultation with relevant experts and international organizations.